Welcome, everybody. I'm Ashley Brower, Communications Director for the Foundation for a Healthy Kentucky, and we're glad that you could join us for this Health for a Change webinar focusing on increasing confidence in COVID-19 vaccines for children ages 5 and up. Before we begin, I do want to say our thoughts and prayers are with those impacted by the weekend tornadoes in Western Kentucky. And as we all work to figure out how we can best help our fellow Kentuckians, we continue to keep them in our thoughts and prayers. And as we continue to respond to the COVID-19 pandemic, we've partnered with Anthem, Blue Cross, and Blue Shield Medicaid on the High Five for Health campaign. The idea here is to spark conversations that will hopefully build confidence in the vaccines, specifically for children. With us today, we have Dr. Dan Brunner, Medical Director for Anthem, and Dr. Eloise Weeks, Behavioral Health Medical Director for Anthem. Dr. Brunner is a board-certified emergency medicine physician. He practiced emergency medicine in Kentucky for 24 years and became a medical director for the Kentucky Anthem Medicaid plan earlier this year. Dr. Weeks is board certified in psychiatry. Prior to joining Kentucky Anthem as the behavioral health medical director, she practiced inpatient and outpatient psychiatry in Jonesboro, Arkansas. So both doctors were with us on a series of focus groups that we held to find out what Kentuckians, specifically parents, think about COVID-19 vaccines for children, what they mean for their families, schools, sports, and other activities. And that's what we use to inform our new High Five for Health PSA campaign. Now, Anthem Medicaid is a leader in this space and is passionate about getting more Kentuckians, young and old, vaccinated against COVID-19. They see these vaccines as key to getting past the pandemic and keeping us all safe and healthy. Before we get started, I do want to share a little bit about the foundation. So we are a nonpartisan organization created to address the unmet health needs of Kentuckians. And we do that by developing and influencing policy, improving access to care, and reducing health risks and disparities, and promoting health equity. So our goal is to advance policies that foster health equity and amplify voices. The pandemic has certainly laid bare the health equity issues across our Commonwealth, our nation, and the globe. And getting more folks vaccinated helps protect the most vulnerable among us, and means we're closer to getting things back to the things that we love. And we're all in this together. And as we dive into the insights, suggested messaging, and materials that we've created to share with you, please do not hesitate to ask any questions in the chat box, and we'll answer them throughout our presentation today. Dr. Brunner, if you would please start us off by talking about what we heard in those focus groups, as well as what you're hearing from patients, and share the insights from our parents that we talked with.
Thank you, Ashley. One of the biggest take-home messages we found that parents trust their primary care provider and want a personalized recommendation from that provider. We heard this from parents, regardless of where they are in the decision-making process, from parents that are reluctant and have concerns to those that are committed to vaccinating their children. Parents are taking a lot into consideration when they do schedule a vaccine appointment, such as where to schedule the appointment, whether it be at a doctor's office, a pharmacy, a health department, a school, or a church. They want to make sure their child's medical records stay together and with their primary care provider. We need to remind parents that no matter where the child gets vaccinated, all vaccination records are sent to the state's registry where their doctor can access those records. Other considerations are when to schedule the vaccination. Parents are considering the possibility of the child missing school, activities, or sports, and they want to schedule before downtime. And a perfect time may be the upcoming winter break and Christmas break. We think it's important to talk to parents about think of it as a wall of immunity around other family members that cannot get vaccinated, such as those under 5, especially newborns, and those that are vulnerable, specifically the elderly or those with a weakened immune system. Finally, parents need to be reminded if their child has an underlying medical condition such as asthma or diabetes, the risk to the child being seriously ill from COVID is much higher than any side effect from the vaccine itself. Any questions there? Thank you.
Doesn't look like we have any questions just yet. You know, one of the things is as we wait to see if we have any, we know kids don't want to get shots. Nobody wants to get a shot. And there's a lot of fear and anxiety that goes along with that for folks of all ages. So Dr. Weeks, could you help us understand what are some of the things that parents can do to help their children through this process so that it's a little easier, maybe a little more positive for them?
There are a few things parents can do to help ease their children's minds in regards to anxiety they may have regarding getting a vaccine. One of the main things to do is to find out where they are in terms of their understanding of the vaccine and why we're doing the vaccine. Once you get an understanding, be honest with your child, make sure that they understand that, as we have emphasized earlier, that the vaccine is to help not only them be healthy, but also to protect their loved ones and their friends and those who may not have as strong as immune system as they do if they are not immunocompromised. Another thing that can help parents in preparing their child for the vaccination is to practice at home, practice how the process in terms of asking them where they want to sit. Do they want to sit in your lap or do they want to sit beside you when they're at the doctor's office? Asking them if they would like to hold your hand or not. Asking them if they would like to bring something from home. Sometimes preparing and bringing a stuffed animal or some comfort object can help younger children handle getting immunizations better. The other thing is to also be calm yourself. I know vaccinations can not only be an anxious time for not only children, but also adults. So making sure yourself are able to be calm during that moment can help your child go through the process smoother. Another thing is the wording that we use in terms of vaccinations. Instead of using the word shot or stab, maybe use the terminology such as a pinch or prick. That may help also lessen the child's anxiety regarding vaccinations.
Thank you, Dr. Weeks. We still don't have any questions just yet, but if you all have any, please ask them in the chat box. So what the Foundation and Anthem Medicaid did is take these insights, what we heard from our parents across the state, Doctors Berner and Weeks perspectives, and also a host of research. And we put together a campaign called High Five for Health. And it is a public service announcement campaign that features animated videos, social media graphics, posters, and flyers that can be hung up in doctor's offices or youth organizations. They can be printed out and passed out to parents as a take home. And we're providing those in English and Spanish with hope that they really do give some helpful tips to parents and caregivers and address the concerns that they may have in getting their child vaccinated, especially the younger ones, ages 5 through 11. So what you're seeing right now is an example of a social media carousel that you would post all of these slides and be able to click through. And these are our 5 steps for getting your child vaccinated. Talk with your pediatrician, talk with your child, schedule the vaccine, And then have a vaccine ready kit. Hydration being key. Maybe have non-aspirin pain reliever on hand just in case, and then get the vaccine. So we have also, like I said, here's the example of the poster. We've got several social media graphics that are available, and we continue to make those and have additional translated material in Spanish throughout the next couple of weeks. Let me show you a couple of the videos. And here is another one. Okay, so that's a look at what we have available for you guys to download off of our website. It's on healthykentucky.org, but we've also created a special URL for that, High Five for Health, and I will put that in the chat box. We are starting a paid digital marketing campaign to go all across the state. And specifically targeting parents, being that winter break starts next week for most folks. We feel like it's a great time for them to consider getting the shot because there may be less activities and sports and school and all of that good stuff for them to schedule around. It might be easier, but we have the materials up on our website right now. And we are continuing, like I said, to add additional materials. Also many more translated into Spanish materials. So let's see. We do have 2 questions. How would you respond to a parent who says their child has already had COVID, so they believe they have natural immunity and are disinterested in the vaccine for that reason? And she's got an example. In our case, the same parent said that they felt their child was too medically fragile to receive the vaccine. This child has type 1 diabetes and is celiac. Is medically fragile an actual designation that would prevent a child from receiving the vaccine? So we actually heard this in our focus group too. Dr. Brenner, do you want to speak to that?
So the first part of that is, yes, a child or any human could have immunity from a prior virus, specifically the COVID virus, but it's been shown that immunity does not last. The child could immunity goes down over time, and even if you've had COVID in the past, it is still recommended that the child receives the vaccination. Again, the child who is weakened or has medical problems, they are more likely to have serious COVID, complications from COVID, if they get the illness, as opposed to becoming vaccinated. That actually protects children that have fragile conditions, such as one you mentioned.
One of the things that really resonated was the idea of creating a wall of immunity as well. Dr. Brunner, can you expand on that?
So there are many young children, specifically newborns, who are very fragile, do not have mature immune systems yet. It is best to immunize those around that child, specifically in the household if they're eligible, to protect that child, since they cannot receive the vaccine themselves. You're then less likely to bring that virus into your home and infect your child unintentionally.
Okay, Megan, I only see one question there. If you have another one, please drop it in. We've also got a question, does any of the material address the safety of the vaccines? We have information in our frequently asked questions regarding the safety of the vaccines. One of the concerns and confusion points we heard in our focus groups was parents not sure if kids, if their 5-year-old is getting the same dosage that maybe they got initially, or that just adults in general are getting. But it's about a third of the amount. Dr. Brunner?
They found in the original trials that when children under 12 were given the adult dose, they didn't have complications. They just had very, very robust responses, higher fevers, body aches, headaches. They then lowered the dose by 2/3 to give a 1/3 dose. And they found that the mild side effects after the vaccine are much less, but they still are provided the same.
And the other question is, will the materials be available pre-printed? Right now they're not, but I'll drop my email in the chat box. And if you want to chat further, be happy to talk with you, see how we can work with you, because we want to get the information out. And Caroline asked if we will be posting these, and we would love for you guys to share them or post them yourselves, because I think getting that information out and from reliable sources and countering some of the misinformation that's out there is key to helping build that confidence. Dr. Weeks, do you have any other thoughts about talking with parents and kind of what you're hearing?
No, I don't have any other thoughts. I would say it's just important that we make sure we answer as many questions as possible for these parents. They really do respect the expertise of their personal physicians, pediatricians, and family practitioners, from what we've gathered in the focus groups.
So before we go, I do want to share with you just a couple of other housekeeping items. We do have our next Health for a Change training series webinar next Monday. It is focusing on comprehensive health education and how that can improve long-term health outcomes. The registration link will be up soon. Watch your email for that information, and check on healthy-ky.org in the coming day or so. We'll get that on there. If you have any questions, please follow up with us. You can email me or follow us on social media. My email is right there. And like I said, we'll be pushing out this information on all of our social networks, and we hope that you're following them and sharing or posting on your own as well. And we'd love you to tag us. So I will end it there and give you all back some time in your day. Dr. Brenner, Dr. Weeks, we thank you all so much for being here today. And we really applaud your all's effort to help increase confidence in the vaccine and help us get through this pandemic. So we thank you all. Have a wonderful day.